Hi Paige, how are you?
I'm good. How are you?
I'm good. My name is Jasmine. I'm the intake therapist here at ORC. I wanted to welcome you in. Thank you for coming in today. Before we get started, I do want to go over a few things, being confidentiality. So everything that you say today here is confidential. No one else will know about it and things like that. There are two exceptions to the confidentiality, and it's if um, I feel like you are in danger of harming yourself or others, then I do have to notify my supervisor or the authorities to take the proper steps to ensure that you're safe. Or if I suspect that there is neglect or abuse of a child or an elderly person, then I also still have to notify my supervisor. We could possibly have to notify the authorities as well, and just take those steps just to make sure that everybody is safe. Does that sound okay?
Yeah, that's good.
Good. Another thing as well, I know like sometimes when people come in, they're freaking out whether their insurance covers things. Rest assured, your insurance is covered, so you're all good. No, you don't have to pay anything out of pocket. So it looks like you're just coming in by yourself, right? Coming in on your own free will.
Yeah, yes.
Okay. Can you tell me a little about what's been going on?
Yeah, so I was diagnosed bipolar maybe a couple years ago now. I had an episode, I guess, I don't know, I just haven't been feeling great lately. Really down, I guess. So I think it was kind of another episode. I didn't go to the hospital or anything, but I do have a therapist that I sometimes see for bipolar, but I didn't see her this time.
Okay. I'm sorry, let's take a quick pause. I will be writing during this just to make sure that I don't forget anything.
Okay.
Is that okay with you?
Yeah, that's okay.
If you ever want to look at it, you can look right here or we
Okay.
can go over it, just to make sure that I have things correct.
Mm-hmm.
So what I'm hearing is that you had an episode recently.
Yeah.
You said it was a bipolar episode, but do you know if it was depressive or hypomanic?
Yeah, I think depressive. I'm still kind of feeling a little down.
Okay, so you've had a depressive episode recently, and you say you do have a therapist, but they're not really doing anything for you. It's not really beneficial.
Yeah, well, they don't want me to drink, and I like to drink. So when I go there, I kind of just get mad because they seem like they want to treat that and not treat my bipolar.
Okay, so
And I just want them to treat my bipolar.
Okay, so I heard you say that you like to drink, right?
Yes.
So how much do you drink?
I guess maybe 4 drinks every day.
4 drinks every day.
Some maybe more on the weekends, but I guess yeah.
And then what are you drinking? Is it like strong liquor, beer?
Vodka.
You're drinking vodka. Okay. Do you notice when you start to drink like the time of day it is? Morning, noon, night?
It kind of depends on what I have to do that day, but if I don't have too much going on, maybe early afternoon.
Okay. And about how much do you spend on the alcohol?
Oh gosh, money?
Yeah.
Maybe $40 a week.
$40 a week?
Maybe more. Also, probably more if I go out and drink. It's cheaper if I drink at home.
So would you ballpark maybe about 40 to 100 if you go out? Does that sound right?
Yeah, probably actually 50 a week if I stay in, and then 100
if you go out. Okay. And then how much time do you spend drinking? So you say you drink about 4 drinks a day. Do you do this in one sitting or is it throughout the day?
Again, kind of depends, but usually throughout the day.
Okay.
I like to make a drink and do other things too.
Other things like what?
If I have to clean the house, I'll drink. If I just lay in bed and watch TV, I like to have a drink with me. I don't drink and drive. If I know I have to drive somewhere, I won't drink.
Okay.
But if people come over, I like to drink. If I go to other people's houses, I ask them if they have anything to drink.
So it sounds like you're a bit of a social drinker and just kind of like to drink on your own too.
Yeah, I think I like drinking on my own better.
Okay. One moment, I'm just jotting down that note really quick.
Yeah.
So I hate to backtrack a little bit, just kind of diving away from the subject of drinking for like a hot second. I want to get into this by the bipolar. You said you had this depressive episode a little while ago, and you said you're still feeling a little bit down. So what exactly is like going on?
I don't know. I just kind of, I guess I've probably had like multiple episodes at this point, and I'll go a few months feeling pretty good, and you know, being productive and doing things that I should be doing, or I feel like I should be doing, and then like all of a sudden there'll be days I just don't want to get out of bed. I don't want to talk to anyone. Sometimes I'll call in sick to work. Um, and I've been doing that a lot the past couple weeks. I haven't gone to work a lot.
So you've missed work.
Mm-hmm.
So you say you've had a couple of episodes. What do you mean by episodes? Are you specifically thinking or speaking about like the depressive episodes, or have you had some hypomania going on in there?
Yeah, I don't know. I guess what my therapist tells me is I think I've had like a little bit of both. I was hospitalized one time for what'd you call it?
Hypomania.
Yeah, for that once. And then the other times, though, I think I mostly just feel sad.
Okay. So you're saying you've only had one manic episode? Okay.
That I know of.
Okay. But mostly it's just the depressive episodes going on?
Yeah.
Okay. How long ago was that hospitalization?
Last year.
Last year. What was going on? That must have been really scary to wake up in a hospital.
Actually, it was maybe a couple years ago because that's when I was first diagnosed.
Okay.
Yeah, it was scary. I don't know. I thought that, like, I was having fun and I kind of liked how it felt. But then, my mom thought I was acting really weird. She thought I was on drugs, actually, and I, like, promised her I wasn't taking any kinds of drugs. I had been drinking then, but, like, not a lot, I guess, or nothing more than I am now. And I guess she thought I was just kind of being, like, weird for maybe a week or so. I wasn't sleeping. I stopped sleeping. I just was doing a lot of other things. And I felt really productive. Like I said, it kind of felt good. But then, yeah, my mom made me go to the hospital.
Okay. So I remember you saying a few minutes ago that when you're not in the depressive episodes, you do feel really productive. During those times that you feel productive, are you sleeping?
Yep.
Okay.
I guess not even, like, really productive, but to me, that kind of feels like making sure I go to work when I'm scheduled, or like grocery shopping.
Oh, kind of like the normal daily life type tasks, things going on there?
Yeah.
Okay. So you said that back then you were drinking, but not as much as you are drinking currently. When did you notice that your drinking increased?
I don't know. I think, like, a lot of the times when I do start feeling depressed or really sad and, like, down, I drink a little more to try to make me feel better.
Okay.
So I guess it just maybe has, like, slowly increased since I got that diagnosis.
And then you said you got this diagnosis a few years ago. Do you remember the exact year?
I think it was like 2016.
2016, okay. So with that being said, like, tell me a little bit more about you. Like, what's going on in your life? What are you doing?
Like where I work and that kind of stuff.
Yeah, where you
like
work.
General.
Yeah, like where you work. Where, like, are you in school? How's that going?
Yeah, I take some classes. I was like a full-time student before I had that first episode, and then I kind of went down to part-time. But I've still been trying to take some classes. I'm in art school, and then I work at like a little coffee shop.
Okay. So, are you getting? Is this your bachelor's or master's you're getting?
My bachelor's. I'm almost done though.
Okay. So you're in art school. You're getting your bachelor's degree. You said you were full time before you got this diagnosis, and then once that happened, you dropped down to part time. So far, how's school going for you?
It's good. It was hard having to go down to part time. I feel like pretty behind.
Mhm.
Like all my friends have graduated and have been working probably for like a couple years now. So it's kind of discouraging, I guess. And I think that maybe like is why sometimes I want to drink more because it just helps me ignore those things too. But
So you find that you compare yourself to your friends who have, graduated and moved on, and then when you do that, you become discouraged and down, and it makes you want to drink more.
yeah,
Okay. So you say your friends have graduated and moved on. It doesn't tell me your age and your referral sheet. How old are you?
25.
25. Okay. I just want to say college is hard, and then having a diagnosis like bipolar disorder, it definitely makes it harder.
Yeah.
Um,
Yeah, it's hard.
it's already stressful enough, and then having those mood changes, it does not make it any easier at all.
Yeah.
Are you currently on any medication for the bipolar disorder?
Yeah.
What are you on?
I don't remember what it's called.
I don't remember. Okay, that's fine.
Like a few different things though.
Okay.
And I know that when I see my therapist and like the psychiatrist, they tell me that I should not be drinking on the medication that they give me too. So I don't know. That's kind of like I don't like going to them a lot because they make me feel bad.
So they make you feel like they're judging you because you're drinking on the medication.
Yeah.
So you mix the two. How are you feeling when you mix the two? What are you noticing going on in your body?
I don't know. It kind of feels like definitely different, like a different kind of drunk, I guess, than when I didn't take medication before. I feel like I like feel it quicker, if that makes sense. It's easy for me to kind of just like zone out and not care about other stuff. Like I'm in my own world, I guess. But I think like there's health risks for drinking.
Yeah, definitely.
On those kinds of medications, so I kind of want to get help with that.
Okay. So are you saying kind of like it makes your body go numb?
Yeah.
Basically,
Yeah,
and you just kind of block out everything then. Okay. So, based on what we've discussed so far, I do have a few concerns. One of them, of course, being the drinking, and then drinking while on the medication for your bipolar disorder.
Yeah.
And another concern I do have is the bipolar disorder and whether the medications that you're taking, if they're working, but you did say you're drinking on them, so that could also affect them too. And like you said, health risks are a major concern when you're doing that. And so based off of those two things, I do want to go over 2 questionnaires with you. They'll be really quick, and I'll explain to you, what they mean and things like that as we go along. So how do you feel about that?
Yeah, that's okay.
Okay, cool. So the first one we're going to do is the Patient Healthcare Questionnaire, or the PHQ-9. This measures for depression. We already know you have the bipolar disorder, but I just want to get a little bit more of a feel for how it's been in the past 2 weeks.
Okay.
And then we go from there, okay? Okay. So how often have you had little interest or pleasure in doing things? Not at all, several days, more than half the days, or nearly every day?
Several days.
Several days. Keep in mind this is over the past 2 weeks, just
Okay.
in case I forgot to mention that. What about feeling down, depressed, or hopeless?
Several days.
Several days. What about trouble falling or staying asleep or sleeping too much?
Sleeping too much. Like several days.
Several days too? Okay. Feeling tired or having little energy?
Several days.
Several days. Poor appetite or overeating?
Like all the time.
So do you want to say nearly every day then?
Yeah.
Okay. How about feeling bad about yourself or that you are a failure or have let yourself or your family down?
Wait, what is it? Oh, so several days is meaning like less than half the days?
Yeah.
Oh, sorry.
You're fine.
I would make all these nearly every day.
So for the first 4, you want to change it to nearly every day then?
Yeah, I thought
Okay.
that's. I misunderstood.
Oh, I'm sorry if I wasn't clear.
No, that's okay.
Okay.
That's
We're
more.
good?
Yeah.
Okay. What about feeling bad about yourself or that you are a failure or have let yourself or your family down?
More than half the days.
More than half the days? Okay. Oopsies. Scribbled in the wrong one there. What about trouble concentrating on things such as reading the newspaper or watching TV?
And like my homework and stuff.
Things like that.
More than half of the days.
Oh, look.
There you
Having
go.
to circle the right one. What about moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual?
I don't think maybe none of the days.
None of the days? Okay. Thoughts that you would be better off dead or hurting yourself in some way?
No. I get like, I'll wonder maybe what my purpose is.
What your purpose is?
But
just kind of
nothing
thing
like,
that.
yeah, not anything that like, I don't want to hurt myself, and I don't have thoughts of that ever.
Okay, so these questions, the next few questions I'm going to ask you, they're not a part of the PHQ-9, but this is just to measure for safety. So you said you haven't had any thoughts of suicide. Is that just recently, or have you had any thoughts or plans to kill yourself within like the past 2 weeks?
No, I never would say I've had any thoughts of suicide.
Okay. This may sound a little bit redundant, but I just have to make sure that things are okay. Have you ever made a passive attempt at taking your life?
No.
What about an active attempt?
No.
And then what's your willingness to live? What would you say? Is it strong, moderate, weak, or none?
Strong.
And then what is your willingness to die? Strong, moderate, weak, or none? Okay. Thank you for answering those for me. So I'm going to calculate this up really quick. Give me one moment. I'm going to have to do some finger math here. All right. Oh, I missed a question. So out of all the problems that I read off to you, I'm sorry. How difficult have they been for you? Somewhat difficult, very, or extremely, or not at all?
I think like extremely difficult.
Okay.
Yeah, it's just getting in the way of, like I said, like school and work and that kind of thing.
Okay. So far, I have a score of 19 for you for your PHQ-9. What this just telling me is that you have like some pretty severe depression going on. Right now, like we know you're diagnosed with bipolar disorder, but it just seems like your most recent depressive episode was pretty bad.
Yeah.
Okay.
I'd agree.
Okay. I do want to move on to the Jesus Christ. The audit, which is the Alcohol Use Disorders Identification Test. These are 10 questions. We're going to fly through these really quickly, and this is to measure for the drinking.
Okay.
And see where we're at with that. Okay, you ready? So you said you drink every day, right?
Yeah.
Okay. So some of these I already know, so
Okay.
I'm kind of not going to ask you a few of these, so we don't waste time. And you say you have about 4 drinks when you do drink? Okay, so we're going to answer that. So how often do you have 6 or more drinks on one occasion? Never, less than monthly, weekly, or daily, almost daily?
Whatever, like maybe a couple of times a week would be. I don't know if that would be weekly or almost daily.
It's up to you.
I guess weekly.
Weekly? Okay. I really hope I didn't make the sound. That's the only thing I'm afraid of. How often during the last year have you found that you were not able to stop drinking once you had started? Never, less than monthly, weekly, daily, almost daily.
Less than never. I don't know. I usually just drink until like I'm tired. Like I'd rather sleep than drink. If that makes sense.
So what do you want to put for that then? So here, let's look at it together.
Okay.
So the question was again, how often during the last year have you found that you were not able to stop drinking once you had started?
Okay, I'll say less than monthly.
Less than monthly? Okay.
Yeah.
How often during the last year have you failed to do what was normally expected from you because of your drinking?
It's hard to tell if it's like from drinking or bipolar, but I guess weekly,
Weekly? Okay.
maybe almost daily actually.
So do you want to go weekly or almost daily?
Weekly.
Okay. How often during the last year have you needed a drink first thing in the morning to get yourself going after a heavy drinking session?
Monthly.
Monthly? Okay. How often during the last year have you had a feeling of guilt or remorse after drinking?
Almost daily.
Almost daily. And then how often during the last year have you been unable to remember what had happened the night before because you have been drinking?
Monthly.
And have you or someone else been injured as a result of your drinking?
Well, I guess my health is probably at risk, so.
Have you been injured? Like, have you ever been drunk and fallen down? You say you don't drink and drive, so that's kind of out.
No.
Okay.
Nothing like that.
Okay. Have you ever injured someone while you were drunk?
No.
Okay. And then, has a relative or friend or doctor or another healthcare worker been concerned about your drinking or suggested that you cut down?
Yes.
And has it been in the last year or not?
Yeah.
Okay. So it's been in the last year. One moment as I calculate this, or try to. Alright, so I got a composite score of 24 for your audit. And what this is telling me is that there's some abuse going on, and a little bit of dependence. Have you ever had any withdrawal symptoms from drinking?
Maybe. Like not feeling good.
Like, have you ever had tremors, shakes, sweating, nausea, vomiting, headaches?
Yeah.
So you have gone through withdrawal then? Before.
Yeah, I guess I sometimes get confused if that's from the bipolar medication or like eating certain foods with the medication I'm taking or if it's from alcohol. I've had those feelings, but I don't know what they were from exactly.
Okay. So it sounds like there's a little mix-up going on there as to whether you really felt the withdrawal. Have you ever been hospitalized for drinking at all? Okay. So, with that being said, I think I am going to kind of classify that as some dependence going on here, just from the time spent drinking, your increased tolerance, because you say you didn't drink as much before as you do now, drinking while on, your medication, spending, the amount of money you spend on the drink, well, not the drinks, but alcohol, that, so what I'm thinking, because we are kind of dwindling down to the end of our assessment, is that I think outpatient would be a good route for you. What do you think?
What's that like?
Outpatient therapy. So you come in, you say you already have a therapist, but it's not really working out for you.
Yeah, I would kind of like to see someone else.
Okay, so you can come here and you can make appointments as needed. It's really whatever your insurance will cover. I think your insurance covers about 6 months of outpatient, I believe.
Cool.
You can come once a week, you can come twice a week, and you just come in and you work with your therapist on different interventions, like CBT is really good for drinking, to try and get that under control, and just kind of whatever else is going on, like what's going on with these depressive episodes, like, how you're feeling, and just kind of talking about things going on in life to better assist you.
Okay.
So does that sound like something you may want to do?
Yeah, if they don't judge me for drinking, I guess.
Absolutely not. We are definitely a judgment-free zone here. So do you have any questions for me, or would you like to set up the appointment for like this week or next week, or do you want more time to think about it?
I think I'll set it up.
Okay, so how's about like this Thursday for noon? How's that sound?
Yeah.
You can either meet with me or another therapist if you would like to. It's completely up to you.
I'll meet with you so I don't have to like
Go through
talk
this
about
all
it
over
all
again.
again.
Okay, so I'm definitely free. We can do that. Do you have any other questions or things like that for me?
No.
Okay. So in the meantime, I do want to give you a little bit of information, just so you can have for like our next session, so you know what's going on. This is the NIAAA's drinking guide, and it just lets you know what classifies as a drink,
Okay.
wine, vodka, beer, and then how much women are supposed to drink in a week, and it's just basically to try and start to have you stick to those limits. So you say you only drink 4 a week, and it's vodka though, so it's kind of strong.
Yeah.
So maybe try cutting down to 2 drinks a day, maybe,
Okay.
if possible.
Maybe this week could I do like 3 first?
Yeah, that's totally fine. It's whatever you're most comfortable with. So with vodka, the drink, what classifies as a drink is about 1.5 ounces of alcohol. Whether you take a shot, whether it's a mixed drink, anything like
Okay.
that, and it's recommended that women only have about 3 to 4 drinks a day, and then like no more than 7 a week.
Okay.
So that's kind of
Okay. I'll try to follow these better.
Well, that's all I ask. If you think about it, see how it works out. Just do whatever is most comfortable for you, and then we can talk about your progress or what you've done.
Okay.
On Thursday. Does that sound good?
Yeah, that sounds
Okay,
good.
good. Do you have any questions, concerns, or anything for me?
I don't think so.
Okay, great. Well, it was very nice meeting you. Thank you again for coming in. I really appreciate seeing you. Just to recap of what we went over today, we did our initial assessment. We went over the PHQ-9 and the audit, and we determined that your last depressive episode was pretty severe and how you were feeling and things like that. And we've also determined that with your drinking, it's a little bit of dependence based upon your behaviors and your spending habits and things like that. And from that, I did give you an informational sheet on drinking, and we set up an appointment for next week.
Okay.
Sound all good?
Yeah.
I know that was a lot. Sorry.
Sounds good.
All right, great. I will see you on Thursday.